Hello, this is Dr. Arhiri with Premier Smiles. Today we're going to be talking about the topic of root canals. A root canal therapy is the procedure where the nerve of the tooth is taken out because that nerve was damaged either to bacterial attack or mechanical trauma. The signs can be visual, which can be an abscess, or radiographically, where the bone is being affected by the infection at the tip of the root of the particular tooth. And usually the patient has symptoms as far as like pain, throbbing, dull ache, pulsating, keeping them up at night. If a tooth is cracked, sometimes it can be saved with the root canal therapy. However, it's not a guarantee. Sometimes that tooth cannot be saved and needs to be extracted. When there is too much destruction to a tooth due to decay or mechanical trauma, at that point, the tooth is not restorable. A root canal is not necessary. It just means that the tooth is lost, so it needs to be extracted. So during a root canal therapy, the patient is anesthetized properly, and then an access through the top of the tooth is made to go all the way to the pulp chamber, where the nerve is taken out of the chamber and the roots themselves, where everything is disinfected, sterilized, and then after that sealed. A root canal therapy can last anywhere from half an hour to an hour and a half. It depends. Usually the posterior teeth require more time because they have more roots. In the anterior teeth, less time because they have one root. Definitely after root canal therapy, it's recommended for the tooth to be crowned because during the procedure, along with the removal of the nerve, the blood supply is cut from the tooth. So from that point on, that tooth is not, it's a dead tooth, which is weaker. That's why a crown is recommended to reinforce that tooth. Usually we use carbocaine initially because it's less acidic and the patient won't feel it as much. And after a couple of minutes, a shot of septocaine is administered to the patient for more deep anesthesia. A root canal is definitely safe. It's the whole environment around the tooth is isolated. The decay along with bacteria, it's safely removed from the tooth. So basically there is no special preparation except obviously coming into the dentist's appointment and let the dentist do the procedure. Sometimes depends on how infected the tooth was. The patient might experience discomfort, dull ache, sensitivity for a few days afterwards, in which case it's recommended some painkillers, possible some steroids, or even more antibiotics. Sometimes yes, sometimes no. Again, depends on the extent of the damage and the infection. In most of the situations, the recovery time is 1 or 2 days. Some cases might require a little longer, other cases even less. Doing a root canal on the tooth, that means we're saving the tooth. That means we're using the same tooth which you had from when the first came in your mouth. But an implant therapy, it's also a good solution if there was no other option except to extract the tooth. So implants can be placed safe with no problem, and they're as good as saving the tooth with a root canal. It depends from dentist to dentist, from where the tooth is located in your mouth. Normally the anterior teeth, they cost less because there's only one root involved versus the posterior teeth, which they have usually 3 roots, and it's more costly. Also depends on your insurance plans and some other factors. If you do feel like you need a root canal, please feel free to call us at 610-647-7611. This is Dr. Arhiri with Premier Smiles.